The first, obviously, so I talk about is what we're doing in the Gulf Coast. Unfortunately, our resources, like many other government agencies, have been pulled down to this catastrophic set of events that occurred at the Gulf Coast. OSHA did not have any jurisdiction over the oil rigs. One of the things you learned is there's some very complex jurisdictional issues, and the Mineral Management Service for the Interior Department was responsible for worker safety, among other things, on the oil rigs. But OSHA is responsible to ensure the safety of the cleanup workers. Once that oil hits the shores or hits the marshes, they're responsible to make sure workers there, that no more workers are killed or hurt related to this event. We already had 11 workers lose their lives on the Deepwater Horizon. We certainly don't want more. So I flew down there the same day President Obama flew down there right after the event occurred. I went coach, unfortunately. But it was, and OSHA staff came from our Region 6, which is the Southwest, and Texas, and Louisiana in Region 4, from Atlanta, essentially to make sure that we're in every staging area from Florida to Louisiana, looking at the training programs, insisting that workers are trained properly, that they get the proper equipment. And it's very resource intensive, and we have a lot of people who we've pulled away from other projects, but it's extremely important. One of the things that we've made very clear to BP and to everybody else involved is that workers not only have to be trained, but they have to be trained in the language that they speak and understand. And that's true across the administration, but we are spearheading it. We've actually sent Vietnamese-speaking OSHA staff down there and Korean-speaking OSHA staff, Spanish-speaking OSHA staff to make sure that the training is done in those languages. We've translated materials to those. We work very closely with the National Institute for Environmental Health Sciences and their hazardous worker training program. We've also worked, we're really working hand in hand with them. And it's really quite remarkable. I don't think this has ever been done before, where we insist that the training sessions go on in Vietnamese. And also very much insisting that local people be hired to do this work, because it's being so disruptive of the economy down there. And our Secretary of Labor has made that a very important priority. We're pushing very hard to do that. It's, from a safety health professional's point of view, it's a very interesting challenge. And how should these workers be protected? And it's really an ongoing, the situation is I would say volatile in certain ways. Right now, at least in terms of our hazard assessment, when the oil is coming to shore, it's very much weathered, and there are few volatiles, if any, coming off of it. And so we can send people out without any sort of respirators, though they do have to wear protective clothing, much to the dismay of some of the political leadership in the South, which would prefer people to wear flip-flops and shorts because it drives away the tourists. But we insist on proper protection, but not respirators. But that may change, and we're trying to follow it very carefully, because if you get large amounts of oil coming onto shore, we'll have to assess it and continue to look at that. But anyway, it's our ongoing challenge. It's unfortunate because it really is taking away from all the other things that we're trying to do, because we have to have people down there. We can't wait. So we've sent 20 people down there already. And they work 18 hours a day, 7 days a week. We keep them there for a week or two, and then shift other people in and give them a break. What we're trying to do otherwise, though, is really what I want to talk about. And there are a number of different areas that we're really stressing. The first, obviously, the one thing that people think about OSHA doing is we're stepping up our enforcement. And as I said before, the field staff, the OSHA enforcement staff, has been doing a tremendous job for many years, and they continue to do that. We're fortunate in many parts of the government have been given budget cuts. We actually were given an increase last year, and there's more money, and also another increase in the President's proposed budget for 2011. We've hired an additional 100 inspectors. That sounds like a lot. I don't know if you saw ABC News had this thing that OSHA's going on OSHA's going to get really tough. They hired 100 more inspectors. Well, we cover somewhere around 7 million workplaces and 133 million workers. So 100 inspectors helps, but still it isn't enough. But with our 100 inspectors, I think 100 additional inspectors, we're doing a terrific job. There's no question that the field staff is really takes their job very seriously and is, without ever being told, step up in significant cases. They're doing this, and it's very interesting to watch. We all understand that our inspections have to have an impact on more than just the individual employer who we visit, because we don't have enough inspectors to visit every employer in a century. So therefore, our inspections have to have a deterrent effect. And so we try to publicize the inspections and get it out in the trade press and in the public press, and show other employers in the same industry, in the same region, that you want to abate your hazards before OSHA gets there. And we're very much trying to do that. I'm very pleased the New York office has been way ahead at doing this. In fact, just today, Kay's office, the Manhattan, Brooklyn, Queens area office, is issuing a proposed fine of $125,000 against a Brooklyn contractor who, fortunately no workers were hurt in this event, but essentially a partial building collapse on 3rd Avenue in Brooklyn. There are a number of significant cases they're working on, cases we call egregious cases, which are even worse, usually where someone is very badly killed. Last fiscal year, there were 4 egregious cases across the country. In the first half of this year, we already have 9, and there are multiple ones coming. We're trying to get out there and set an example and say, look, you really can't put your workers in harm's way. But OSHA inspections are not going to be enough. We're obviously thinking about different ways to reach out to workers who are at risk, to tell them what their rights are, to give them information. We have a very, very strong focus on immigrant workers, Spanish-speaking workers, and the most vulnerable workers. This comes directly from our secretary, Hilda Solis, who she has her mission for the agency is good jobs for everyone. And when we look around and see who really has the most difficulty getting good jobs, it's most in danger, are immigrant workers, whether they're legal or illegal. Non-English speaking workers have fewer rights. They don't know what their rights are. We just had a large meeting in Houston, summit on Latino worker health and safety. A few of you were there. It's a very powerful meeting. We heard from workers who got up speaking in Spanish about the conditions they face. Workers who, one worker a construction worker in Austin described being told to load up a scaffold with material being brought up to the 18th story of a multi-story building. He and his colleagues were told to overload essentially the scaffold, even though they said this is too much. The foreman said, keep putting stuff on there. They could hear the motor wasn't working. The scaffold went up. It malfunctioned halfway up. 3 workers fell to their deaths. He managed to hang on for his life. I was able to tell the story about it, what that was. Another worker described how he was on a large job in Tucson. With a nail gun, he put a nail through 3 of his fingers. His foreman said, well, you better take care of that. He got the message. He went home to Mexico for a few weeks, convalesced, came back. No report, never went to OSHA, never got workers' comp. This is the way things are happening out there. We know that. So we're trying to change that. We're very much trying to reach out to immigrant communities through community groups, through church groups. We've signed relationships, we've signed agreements with Mexican consulates. We're talking with other Central American countries to find ways that workers who are endangered can hear about their rights, can contact us if there's a problem. We don't care what their status is. We want to go out and make sure there are no hazards out there. So it's a very big focus of ours. And many of you know Diana Cortez, who's the area director in the Tarrytown office, worked tremendously on that and did a great job. So if you're in the Westchester area, she's the person to contact. Obviously, beyond enforcement, we're very much focused on getting some standards out. During the Bush years, OSHA only got 1 standard out for chemical exposure, chromium, and they did that under Ford order. And a lot of the other standards were very much slowed down. And even without political interference, our standard setting process is extremely slow and cumbersome, and we're trying to figure out ways to move that more quickly. But we will be getting out our cranes and derrick standard very soon. We're very pleased. We've worked on that, and a lot of people in this region contribute to thinking about that. And it's on schedule to come out sometime, I think, in July. And, that would be a great moment because it's a badly needed standard. But there.